People are asking, what is Parryscope? Now, there are all kinds of intellectual property trademarks that overlap with it, from relating to women's health education to minimally invasive surgical surgery to devices. The Parryscope technique, though, as a minimally invasive surgical surface, was a technique that we pioneered where you actually are looking inside the uterus and adding a few air bubbles and seeing if they go through the tubes. So if you look at the uterus with a hysteroscope, so we're talking a fiber optic camera, dimension of a coffee straw, small enough to go in the male bladder in the office without anesthesia. I say it that way because if it can go in the guy's anatomy, most women can handle it pretty well. And you look inside and sort of this little bit of an oval, and there are two dots in the corners, and that's where the fallopian tubes connect. And if you're doing the hysteroscopy and you add the air bubbles, they go over to those corners, and if they go through, the tubes are very, very likely to be open. And if they don't go through, it's not a guarantee that they're closed, but it makes you much more suspicious. And there are various things you can do to sort of reassure yourself or have a better sense of whether the tubes are working. And the ability to get a quick sense of whether the tubes are doing what they should accurately, gently, safely is very important. And the thing is, again, no test is perfect on all those fronts, but it's how does it compare to the others? And generally, women do very, very well. And when you combine it with ultrasound to give you additional information on the pelvis, women can figure out most of the readily detectable factors for female fertility in just one visit. And so you go away with instant answers. The spouse can be there if they want to FaceTime in. We've done that before as well. There are a lot of options for things. But basically, get answers, get support, and know where you need to go.